When applying the shadow guide for needle guidance, first remove the paper backing and adhere it to the scanning surface and sides of the transducer as demonstrated here. Please verify that there are no air bubbles present by smoothing the shadow guide with your finger. Apply a generous amount of coupling gel to the scanning surface of the transducer and shadow guide. A sterile technique is not demonstrated here. However, in an actual procedure, please utilize a sterile technique when inserting the transducer into a sterile transducer cover. In order to achieve optimal delineation of the reference lines, utilize one focal zone and position it in the near field of the ultrasound image. Please note the relationship between the red lines of the shadow guide and the reference lines in the ultrasound image. Using a transverse imaging orientation, localize the target anatomy and position it in the center of the reference lines. Use the red lines on the shadow guide to guide your access needle to the location of the target anatomy. The vessel of interest is shown centered between the reference lines. Notice the highly reflective access needle advancing toward the vessel. You may minimize the reference lines by adjusting the focal zone to the far field of the ultrasound image. This allows for rotation of the transducer into a longitudinal orientation in order to verify the correct needle position.